Well, I am super excited for my guest on this episode because we have not talked in a long time and we were catching up a little bit. And I finally said, okay, if I don't hit record, we're going to run out of time to make this episode. So, Leah Roman, welcome to the podcast. Welcome back to the podcast. How are you?
I'm great. Thank you so much for having me.
Oh, my pleasure. It has been a long time. I think at the very, very, very beginning in like 2017, when I started, the official business, we met very early on.
Yeah.
And I know I had you on the podcast. I've got to look up which episode number it was, but it was very early. So we're hundreds of weeks later bringing you back on. But for people that aren't familiar, and I'm just like geeking out over this little mini reunion here, tell everybody a little bit about who you are and what you do.
Sure. So my name is Leah Roman. I am a public health consultant in the greater Philadelphia area in Pennsylvania in the US. And I have been working in public health in some capacity since 2003. So a long time.
Yeah.
And a lot of my work experience has been focused on health education, training and technical assistance. And then the last 3 to 4 years, I have really focused my consulting business down into working on e-learning and instructional design in public health. I think there's a wonderful intersection there that I know we'll get to talk about a lot. I'm very excited about it. And so that's been a focus of my business the last 3 to 4 years, even though I've been a consultant for about a little over 11 years actually now. And so started as a generalist and then, changed my focus. And that has been my focus more recently. And it's a real passion of mine.
Oh, that's wonderful. There's so many good benefits, I think, of bringing some of our guests back.
Mm-hmm.
You and I were talking about this. I think it's helpful for people who feel the pressure, like early career professionals, recent graduates, feel the pressure to have it all figured out at the beginning. I think it's helpful to bring back someone who was on the show just a few years ago, and you'll see how things pivot so much.
Yes.
So you just need to be flexible and just kind of relax. And then it's also great to just catch up so that, people that are following the podcast, they've, were introduced to you a few years ago and then now get to hear, where you are. And for me, it's an ultra special time to catch up and reconnect. You and I were also talking about how when we were, planting our flag not so much planting our flag, we're really talking about this journey as public health entrepreneurs. We were really the only people, identifying as public health entrepreneurs, and we were trying to figure out, people were doing, were consulting, but not really saying, yes, and I'm an entrepreneur. But now everybody's excited about being an entrepreneur and wanting to figure out how to become a public health entrepreneur.
Yeah.
So it's an interesting twist in watching that journey unfold, you say?
Absolutely. And I think, the landscape has really changed. I always talk about, when I started the business 10 or 11 years ago and made my website, if you Googled public health consultant, I was one of the first people that popped up, because even people that were doing consulting were kind of doing it on the side. They were maybe, they were retired from their full-time position and they did it, and they just kind of got clients from previous colleagues or previous employers. It wasn't so formal, and it wasn't a business in the same way. And now I think if you Google public health consultant, you will get hundreds of people's websites popping up. So it's a very, very different landscape than when you and I, initially connected and felt like we initially became those conveners. There were a couple people interested. Well, how can we get us all connected in some way? Yeah. So it's really different now.
Yeah. In fact, those early conversations we had is what led to the Public Health Consulting and Entrepreneurship Expo. You're just like, let's just see who else is interested. And
everyone is interested now.
Yes. Well, let's focus on you. I want to hear more about your journey, so just, of course, we're going to dive into more of what you're doing right now, but let's kind of go back and just kind of reconnect with my favorite question is, when did you first learn about public health or become interested in public health as a career?
So I first really got interested right out of college. So my first job out of college, I was living in San Diego at the time. I got a job as a reproductive health assistant at Planned Parenthood out there. I had been working there as a volunteer through my senior year in college. And when I graduated, there was a position open for a reproductive health assistant. I ended up getting it. And that position was sort of a combination between a medical assistant and a health educator. And you worked obviously at the individual patient level. But as you can imagine, working at Planned Parenthood, I was really exposed to these broader public health issues around, reproductive justice and access and privacy issues around healthcare. I remember being like amazed that there were all these students from San Diego State, I remember, that were coming to Planned Parenthood. And I remember being like saying to one of the leadership there, like, why are they all coming? Because they have a clinic on campus. And they were saying, oh, they're all really scared that their parents are going to find out that they're getting tested for STDs or that they are getting birth control or whatever it was, because their parents were so closely connected to, paying for college and their health fees and things like that. And I was like, oh, and obviously learning the importance of health education, because I would help patients who were going to be, starting birth control pills or, other types of birth control and things like that. So that position really opened my eyes to the broader field. And I also saw that while I liked working with individuals, I was more interested in the big picture questions. And so after working there for a year, I ended up applying to get my MPH. But that job really was like what got me going in the field.
Yeah. I didn't think I knew that before.
Mm-hmm.
Maybe we did. It's been a while, I remember, but that's a great story because
Yeah.
that's, just kind of represents what you can get exposed to in that first job or those early jobs, and
Mm-hmm.
how that kind of sparks you in a different direction,
Yeah.
or how just the journey itself.
Yeah.
But very interesting start. So right now, is there a particular condition or public health issue that you'd say you're most passionate about?
Really, given my current work, I think what I'm most passionate about or concerned about is the trend of developing a training or making a training to fix any and all problems. And so I think what I have learned between, getting more education and training in instructional design and e-learning, and then doing the consulting work that I do, unfortunately, there's a lot of poorly designed online learning experiences. And so my concern is that I think in a lot of cases, we are putting out things that are not effective. So they're not addressing the problem that they're hoping to address. They're wasting time and money, both on the side of the developers and designers, but also for the learners. And I think, poorly designed online trainings can really turn people off to e-learning in general. I'm sure we've all experienced going through a terrible training and you're like, I never ever want to do that again. So
Right.
I think for me, that was something that really became very obvious, I think, during the pandemic, especially because we had to sort of do emergency e-learning for so many things. Like, let's take this really good in-person training and just like throw it on Zoom. And I think while it was great in some ways, we were still able to connect and access each other, there was also a lot of really bad e-learning that happened. And so I think that that's something that I worry about and that I like to really help people with, is doing in-depth needs analysis to figure out sort of what the problem is we're trying to solve. Is a course or training the right thing? Sometimes it's not. And then helping people, design the best learning experience they can, if that is the correct solution or like one of the right solutions to that problem. So I'm very, very passionate about that.
Well, tell us a little bit more, because that is where you've niched into. So I know you
Mm-hmm.
were a generalist and as a consultant, and then now you have niched into this, structural design. So tell me a bit more about that. Like, what types of designs, and who are your clients, and
Mm-hmm.
like, where's your focus in there?
So I really can work with anyone who is designing an online learning experience, whether that be completely online or a blended learning experience. So blended being that it has some elements of different kinds of learning, whether that be a combination of in-person and online, or live online and asynchronous online. And so anyone who's developing trainings either on public health topics and or for public health audiences. And so that tends to be, public health organizations or colleges and universities. And actually, fellow public health consultants and entrepreneurs have ended up being maybe my most common client, which I don't know that I thought that at first when I initially designed my services, but I am contacted by a lot of other consultants who maybe have a large project that they're working on, and a piece of it is developing an online training or course. And so they want to bring in a collaborator or subcontractor who has more expertise in that particular part of the project. I also get a lot, and we can talk a little bit more about the services that I offer, but I do have a service where people can just pick my brain for one session or multi-sessions. And I have a number of public health consultants that have hired me for that service. They maybe can't afford to hire me to come and design a whole course, but they're doing it for the first time on their own and they need some advice. And so they'll bring me in that way. So that's typically the types of clients that I work with.
I love that you have that though.
Mm-hmm.
That's just a smart move because it sets the stage for great collaboration, right?
Mm-hmm.
And also it's a very smart business move. You sharing in that expertise and being able to package that and offering. That's interesting too, because I wouldn't have expected
Mm-hmm.
that to be your response as like, a common client that you have right now. I'm going back to something that you said about, how the pandemic really was a pivotal shift. And
Mm-hmm.
I do clearly remember how things were people were scrambling,
Mm-hmm.
how do we figure out Zoom? How do we figure this out? And just putting all the information out there in whatever way they could get it out. And I agree, like at least they were getting it done and
Mm-hmm.
getting it done quickly. So kudos. I think a lot of lessons were learned about, preparation. A lot of organizations that had lagged behind developing these, alternative ways to meet people's needs for learning.
Mm-hmm.
They learned that, we need to do better and need to, be a little bit more proactive. And also what comes for me from that is this need, because we focus a lot on supporting BIPOC organizations.
Mm-hmm.
And a lot of what I do is around communication, like between
Mm-hmm.
leaders, design workshops in person, sometimes,
Mm-hmm.
virtual workshops. And it's how we communicating and sharing information. And then also down to the individual members of the community, just relaying that health information in a way that they, uses plain language so people can better understand. So when I hear this and I'm listening to you and thinking about the challenge,
Mm-hmm.
how have you been able to address some of those challenges in the context of learning? Because
Mm-hmm.
especially when we're talking about BIPOC communities, there's a lot of nuances in how we're communicating. So talk a little bit about, how you're kind of bridging that. How do you design,
Mm-hmm.
in a way that's going to, really be relatable to the people the users?
I love that you brought that up. So one of the things that I love about doing instructional design is that it's very collaborative. So, as I mentioned, I always start, if I can, if there's time and budget, by doing an extensive needs analysis. If there's not time for that, I really push for some type of needs analysis where we are figuring out exactly what the problem is. But in addition to talking to subject matter experts in whatever the, maybe public health problem was. So if you were working with communities on, substance use or something like that. So I would, certainly talk to subject matter experts in that. But ideally, you're also talking to the intended learner and talking to people with those lived experiences. And so by doing that as part of the, needs analysis, as part of the design, you are getting to exactly what you're bringing up. What's their preferred learning style? What's the, preferred, technology in terms of ways to engage with them? What are issues around language that we should be considering? And having people in those communities and having intended learners, ideally review everything or pilot things before they go out. I think these are often steps that are skipped either because we don't know to do them, because we say, oh, well, we talked to a subject matter expert, so we're all set. Or people don't have time or money or expertise to do those types of things. But in instructional design, making sure that you ideally have access to the learners so that you can ask those questions and pilot things, I think is incredibly important and something that I love doing. A lot of times I end up being a translator, and sometimes it's hard. And this is why it's nice to bring in a person from the outside like me, where a subject matter expert may say, we need to have all this information in there and it needs to be presented like this and blah, blah, blah. And you feel like you're reading like a lit review,
Right.
And it's like, no, like, and so being able to be the person who says, these are the learning objectives that we are setting out, help me understand how this helps us achieve the learning objectives. And sometimes then they'll be like, ooh, or saying, this is the feedback from the learners. And so we need to adjust this because this is not speaking their language, or it's not making sense to them, or they're asking for this in a different format so that it's more usable. So I think a lot of time the instructional designer is the translator, is the plain language person, because we're able to come at it from a different angle than the subject matter expert who's really immersed in the content and jargon, all day long. So I love that you brought that up because that's something that's very important to me when I'm working with clients on different projects.
Now, all the design instructions, the projects, are they all digitally, like virtual delivery, or are you doing any in person?
So I do either completely online learning or blended. And so typically my blended learning has been a combination of live online and asynchronous online, because that's really where my passion is in terms of the work that I do, more so than an in-person training. So that's typically what I do. And the deliverables can look different. So I have a service called Hands-On Instructional Design, and we really create a custom scope of work for what people need. So sometimes I've had people hire me kind of all the way through, from the needs analysis to the implementation, evaluation, sort of ongoing evaluation. Sometimes I've been hired just to do the needs analysis and make a recommendation for how I think they could best serve to solve the problem. Sometimes people bring me in and say like, oh my gosh, I'm so embarrassed to admit this, but we don't have an evaluation plan. Can you help us kind of retroactively make one? So I kind of help people at all different stages of their projects. I have another service, which is a course audit. So a lot of times if they may already have a course that's live and they've been using for a while, and they'll ask me to take that course and then give them feedback. And so I develop a report and I look at all different kinds of things, from their learning objectives to their assessment tools, their evaluation plans, their accessibility plans, and they get a report on, what they're doing well and what they could improve. So, so I'm really working at all stages of, design of e-learning courses.
I think that's very comprehensive.
Mm-hmm.
And so I know that you said, that you get a lot of, other consultants that come your way, but truly, what is how would you describe your ideal client? Like, in terms of, if I were to recommend someone to you, what would be the type of client that you would feel would be like the ideal for you?
Mm-hmm. I think it doesn't necessarily have to be like, a public health organization or a consultant. But I think my ideal is really somebody who has the budget to do needs analysis, especially if we're at the beginning of the project, because I am not someone who's an order taker. Sometimes we have people get in touch who are like, I want you to make a training with 50 PowerPoint slides and a quiz at the end, and like, it's very prescriptive, even though they haven't done any assessment on the front end. It's just like a box that they're checking. So that type of person is not a good fit for the way that I work. So needs analysis is super important to me. So I think somebody who has the budget, but also the open mind to what I may recommend as a result of the needs analysis is really my ideal client. So it's really, I think that is what makes them ideal. But I think I have had ideal clients both in, from all those categories of public health organizations, universities, and consultants. So I think it's more what they're open to doing in terms of the work, more
Yeah.
so than kind of the organization that they represent.
I definitely get it. And I think that's great. I wanted to thank you for explaining that. I think that's really helpful to hear. And that definitely sets you apart. That's very unique quality. To me, it speaks to, the experience, not just for the client organization, but of course their users, who their students or their learners are, going to be. So great, great, great. Are there any other services that we haven't touched on that you offer?
I think the only thing I'll mention, so I had mentioned the Pick My Brain sessions, which I do either single or 4-pack, the audit, hands-on, and then I also can serve as a subject matter expert specifically related to skills and responsibilities for certified health education specialists. So sometimes someone is creating a course or a training and they are putting together an advisory team or a development team because one reason being that they want to get continuing education units for different types of learners. And so, typically then they need someone who's a CHES or an MCHES to be part of that committee or advisor or review the course in some way. And so I have been a CHES, a certified health education specialist, since 2005, and a MCHES, a Master Certified Health Education Specialist, since their inaugural class. And so between those, the skill set of being, an expert in, e-learning, and then also that experience, people, have hired me to come on board and help advise them on how to make their training a great fit for CHES and MCHES learning audiences. So that's the other thing that I can offer.
All right, that's great. I'm excited for you, and this seems such a natural fit, just from things that I remember in our early conversations, far before you decided to niche here. It just seems like such a great fit for you.
I enjoy it. Thank you.
Yeah. Well, I'm going to shift a little bit. I really like to connect the dots. So you may remember the podcast started out as Public Health Epidemiology Careers.
Yeah.
I think that's when you were a guest. And around episode 209 or 10, we changed the name to Public Health Epidemiology Conversations. And I did that because I really wanted people to move away from, the stress of trying to just get so hyper-focused on the job title, again, leading to what we're talking about, the journey and the pivots and just to be a little bit more open. So I wanted these conversations for them to just benefit from different pieces and parts of the conversations. But that being said, I want to connect the dots because I think there's like public health, a definition here, and then what we do is here, but people don't always kind of see where they connect or where they overlap. So my next question is designed to just make it kind of practical and relatable.
Sure.
So thinking about the meaning definition of public health, how has the understanding of public health help you better serve your clients and community and have a greater impact?
That's a great question. I think, even when I am wearing my instructional design hat and not my public health hat, that public health hat is always there, And so I think the reason, the feedback I've gotten from clients and why they like to hire me is that, even though I'm serving in an instructional design capacity, they like that I speak their language. And so I understand the public health data that they're working with. And so that translation piece is more natural. When I'm designing my interview questions to work with a public health subject matter experts, again, I speak their language and I think I can maybe get to some other information that if I was less familiar with the field might be harder for me. And then depending on the audience, I may have some understanding at baseline of the learning audience also, so if it's a certain segment of the public health workforce, of course, if it's CHES or MCHES and I'm, part of that learning audience, I think a lot of times it can help me ask better questions or when I'm doing a needs analysis, a lot of times I'm diving into data myself when I'm looking at, what's the problem we're trying to solve, what trainings are already out there in the literature, or, and because I'm well connected in the public health field, I have people in my network that I can reach out to answer some of these questions for me. Or maybe I'm looking for a subject matter expert in a, on a certain topic. And a lot of times within my network, I have somebody. So I think that it's helped me be a better translator. I think it's helped people trust me with their courses when they feel like you understand us, and I think it's helped if I do make recommendations about maybe the language they're using to talk about something, they trust my opinion. They feel like I understand the learners and the field and things like that. So I think my public health background makes me a trusted partner for a lot of people.
Yeah, that makes sense.
Mm-hmm.
And you really kind of touched on the next part of that, because
Mm-hmm.
I wanted to ask about, I put the word epidemiology in the title of this podcast because I just
Mm-hmm.
want people to get really comfortable about discussing their understanding of epidemiology. I mean,
Mm-hmm.
how can we talk about public health without epidemiology?
Right.
So, how has your understanding of epidemiology help you, to serve and to have the impact that you're able to have through your
Mm-hmm.
business?
That's a great question. I think, this understanding of just basic epi, I think
Mm-hmm.
understanding like how to read data, even just a data summary and understanding what it means, being able to listen to subject matter experts who are often talking to me in very technical terms, right? Or sending me, 100-page document of data, like this all needs to be in the course. I think being able, to use my basic epi skills to kind of sift through, figure out what is the main point of this data, or ask questions of clarification if I am unsure about something, and then using my epi skills to then maybe repackage it in a way that is more plain language, for the particular learning audience. I think all of those, epi skills are always being tapped to help with the work that you're doing when you're developing e-learning courses.
Yeah, well said.
Mhm.
Leah, I have enjoyed our conversation so much, and we're going to make sure that we have all the links to work, to reach you, connect with you in
Sure.
the show notes for everyone. I just have one final question for you
Mhm.
as we wrap up. Thinking about, our audience of listeners are a diverse group of listeners, but is there any one bit of advice that you would leave for someone who's listening and listen to our conversation and
Mhm.
maybe also be interested in what you're doing?
Yeah, I think making time and space in your budget whenever you can to do some additional professional development in instructional design, if that's something that you're interested in. I think because in public health, we do a lot of health education and training, there's kind of an assumption that we are experts at it just because we do a lot of it. And one of the things that I found when I went back to get a certificate in e-learning instructional design was, while the skills were very much an extension of what I learned in public health, it was a different skill set than, it's a different job to be the instructional designer versus the subject matter expert. Ideally, that same person is not doing both of those jobs, but usually we are in public health. So I think getting trained in those additional skills, so getting to know, adult learning theory, learning how to evaluate beyond a satisfaction survey, which is a lot of times all we do after a training, but to really think about how the training can align with the mission of the business or the client. And then how would you measure more of a long-term change, how to appropriately measure things. I see a lot of clients who are like, we're giving people skills, but they're actually not. They're just giving knowledge, and then they're not measuring skills at all. So I think getting those professional development skills in instructional design is something that I would recommend, because I think there are a lot of reasonably priced things that you can do. So I'll mention a couple things. One is there's a fantastic book that I think if you make trainings and you need to evaluate trainings, I would put it on your desk. So it's Kirkpatrick's 4 Levels of Training Evaluation. So Everyone should have it on their desk. The other thing that I have done, which has been really reasonably priced, that I recommend for people if they're interested, is the Learning Guild. You can get an online conference membership, and it's pretty reasonably priced. And over the course of the year, you then have access to 4 to 6 online conferences, and they're fantastic. Last year they had one all about developing accessible e-learning experiences. They have one coming up on the science of learning, just fantastic topics with great speakers. And you can go back and listen at your own time. So I think trying to find things like that are pretty reasonably priced that you can access in your own time if you want to build up your skills. But it's definitely and then you have to practice, it's definitely a practical skill. So practice, at your own organization or if you're still in school for your projects, if you were going to design a training, how would you work on a needs analysis? If a training's not the best solution, what would you recommend? So think about adding to your skills and then practicing them would definitely be my recommendation.
Perfect. Well, that's really great advice and a great tip. And thank you for the extra the resources in there as well.
Sure.
I have enjoyed this so much, and we can't let this much time pass before we catch up again.
Yes.
So like I said, I will have all the links to connect with you in the show notes. What is the best place? Where are you, people who want to connect with you, where is the best place to send them?
LinkedIn is really the best place to connect with me. I used to do more social media, and I think this would be like a great conversation to have at some point about your business more generally and marketing yourself. But given my newer niche in instructional design, it makes the most sense for me to spend my time on LinkedIn versus spreading myself out too thin with Instagram and Twitter. And now that it's not Twitter, but know. So LinkedIn is the place where I'm spending the most time. So that's the best place to connect with me. And if you reach out, please add a note and let me know, you're coming from the podcast, or if you have a particular interest in instructional design. Those are the requests that I kind of see more easily and, am more likely to be able to connect with you.
Wonderful. Well, thank you, Leah. And we're definitely going to be in touch.
Great. Thanks. Thanks for having me.